Hello, I'm Dr. Dan Alicata for the Joint Telepsychiatry Toolkit of the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. Today I will be discussing technology-specific training in the field of child and adolescent psychiatry. The need for child and adolescent psychiatry services is growing, yet there is a shortage of child and adolescent psychiatrists available to meet these needs, especially in certain rural or inner-city regions. Research has shown that psychiatry services delivered to youth through virtual platforms, as compared to services delivered via therapy in person, are as effective or more effective in the treatment of multiple conditions, such as depression, ADHD, and tic disorders, and are perceived as highly acceptable to youth and parents. Psychiatrists' unfamiliarity with the technology involved in telepsychiatry, the methods to most effectively utilize this technology, or both, are roadblocks to the expansion of telepsychiatry services. Trainees must learn to assess the suitability of technology available for conducting telepsychiatry at both the proximal and distal sites, the strength of the broadband transmission, and the amount of broadband devoted to the maintaining the virtual connection between two or more sites can affect the quality of video and audio communication between sites. Child and adolescent psychiatrists are frequently asked to provide telepsychiatry services to children in rural areas where these connections may be weaker. IT professionals within trainees or distant site facilitators' academic institutions, hospitals, clinics, or communities can assist with establishing and maintaining secure and efficient data transmission. In addition, vendors that manufacture and distribute virtual platforms provide training in their proper use, which can reduce the likelihood of human error and enhance trainees' confidence in responding to technology emergencies, such as dropped video or audio. Proposed competencies for technical training in telepsychiatry suggest that trainees should learn to operate equipment and software used in conducting telepsychiatry, such as cameras and audio equipment. In addition, trainees should not just use the equipment, but rather learn to optimize the unique capabilities of the equipment and troubleshoot technical problems. Psychiatrists, patients, families, and other members of the treatment team can all utilize technology to enhance communication. Psychiatrist training to conduct telepsychiatry should become familiar with technological controls available to them and to their collaborators and patients at distant sites. For instance, trainees should learn to use presets, which can allow them to effectively zoom back and forth between a parent and child in the room at the distant site, to zoom in to observe a child's fine motor skills, or zoom out to observe parent-child interactions during play therapy. Panning features allow psychiatrists to assess the appropriateness of the distant site's environments for telepsychiatry with youth. Certain settings, such as schools or child care centers, may not always have rooms designed for delivery of private psychiatric services. As for patients, having some control over the technology, for instance, being able to use pan features to look around psychiatrists' offices, can both increase engagement of technology-minded youth and help to humanize the virtual therapy experience. I'm Dr. Dan Alicata for the Telepsychiatry Toolkit. Thank you for watching.